Welcome to the February 2026 edition of From the Desk of. I'm Bethany Samuelson Bannow, and I'm privileged to serve as the editor-in-chief of your favorite source for clinical news on the issues that most affect you and your patients as a hematologist. February can be a tough month. The weather is cold and dreary, and the excitement of the holiday season is long gone. Tinsel, pine trees, and menorahs have been replaced with cartoon images of every hematologist's second favorite organ, the one that exists to pump the blood around, as we enter the month of love and American Heart Month. At ASH Clinical News, though, our pages remain full of the latest and greatest about the best organ of all, blood. The issue kicks off with an editor's corner from our new deputy editor, Dr. Andrew Cowan. In keeping with our focus on the role of artificial intelligence in hematology, Dr. Cowan imagines the ideal partnership between the hematologist and AI. In AP Voices, Drs. Abby Douglas and Sarah Tinsley Vance talk about the nuances of discussing what it means to be immunocompromised with hematology patients, a challenge common to all hematology practitioners. While it may be the month of Go Red Day, Dr. David Steensma returns to the pages of ACN with a thoughtful and engaging piece on the color purple in hematology in our Infusions from the Gallery section. I really encourage you to read this creative and thought-provoking piece from a past ASH Clinical News editor-in-chief. This month, our You Make the Call focuses on a clinical question near and dear to my own heart: how to manage VTE risk in a pregnant patient with a history of PE. And as promised, our feature this month is the next in our series on the role and impact of AI in our practice as hematologists. This month's focus is on the role of AI in research and how this new technology can dramatically improve speed and even precision over prior approaches. AI tools bring the capacity to process and interpret large quantities of data in remarkably short periods of time, and in some cases, such as cell image identification, outperforms humans on accuracy. The role of AI in drug discovery, genomics, and trial design is also discussed. However, no tool is without its limits, and so in the latter portion of the piece, we focus on issues like ethical concerns, transparency, trust, and the fact that, as with all technologies, AI tools are limited by the quality and representativeness of available data for input. Next, in Drawing First Blood, we have a highly engaging, though far from contentious, debate between Drs. Julie Jaffrey and Brian Branchford on the role of DOACs in the management of pediatric thrombosis, followed by the scoop on a few ongoing trials in the field of classical hematology that may offer new options to your patients in the search for research. In news, in our In a Different Vein section, we highlight several exciting new publications from ASH's Blood Journal series. This month's selections include results of new studies in classical Hodgkin lymphoma, newly diagnosed AML, and older adults with non-adverse risk AML, reviews on the use of CAR T therapies and implementation of public policies for inherited bleeding disorders in limited resource regions, and a study on the role of CXCL9 as a prognostic marker in HLH, accompanied by an insightful perspectives piece from Dr. Spedito Mukherjee. In Literature Scan, we highlight 3 papers from the JAMA Network and the Journal of Thrombosis and Hemostasis, including a study on transfusions for patients with blood cancers on hospice, accompanied by a perspective piece from Dr. Tom LeBlanc, a study of eltrombopag in pediatric patients with ITP, and one on pharmacokinetic-guided dose reduction of emicizumab hemophilia A. In ASH Directions, you can read the story of how Dr. Janice Lawson has gotten involved in advocacy through ASH, a pursuit she has found highly rewarding. Thank you again for joining us at ACN this month. I'm Bethany Samuelson Bannow, encouraging you, as always, to stay curious, stay informed, and stay inspired.